The Ministry of Health is continuing efforts at protecting the nation's most vulnerable when it comes to the highly contagious whooping cough. Last week, health officials reported that another infant, aged 5 months, had contracted the potentially fatal disease. The Ministry of Health in the last few weeks has been receiving field support from the Pan-American Health Organization, PAHO, and the Caribbean Public Health Agency, CARPHA. The technical advisor to PAHO, Dr. Beryl Irons, says the emergence of whooping cough is not an indictment on the local healthcare system.
Member states of Pan-American Health Organization have made great strides in reducing and eliminating vaccine-preventable diseases. And if we look especially for the Caribbean sub-region, they have not seen pertussis, they have not seen measles, they have not seen diphtheria for many, many years. And we're talking over 20 years, 2 decades. So any occurrence of any case in any of our countries are of great paramount importance for us. So we give the support to the countries. But first of all, I think we need to congratulate the population because they have done an excellent job to ensure that their children are appropriately vaccinated. And that's why they have been able to have no disease in these areas. But we need to remember that disease knows no boundary. So we are tourism-dependent countries, and we not only get tourists in, but we do get diseases in. So our major function is to ensure that the population is so protected that although the disease may come in, we do not have spread.
PAHO and CARPHA have been providing institutional and field support to the Ministry of Health in various aspects.
We support the Ministry of Health of St. Lucia. We think they're doing an excellent job. They have identified what are their major issues, and they're working with them. They're doing their case investigation. They're doing their management. And they are doing activities to ensure that we limit spread, such as the public education that we speak about wash hands hygiene, we speak about cough etiquette, etc. So these are being done and displayed for the population to embrace. And we also encourage, our major function is prevention of disease. And so we are encouraging the parents, and with this we are also supporting the ministry for the children to come in, since they have lowered the vaccination age, for them to be appropriately vaccinated and appropriately protected.
The role of CARPHA is to provide support to its member states for surveillance, for investigation of outbreaks where they occur, and also for diagnostics, meaning laboratory support. And in this respect, CARPHA is also providing the laboratory support for diagnosis of the samples that are being collected from the suspected cases that have been identified. And part of the diagnostic support is actually helping to develop or strengthen laboratory capacity within country, as well as providing reference laboratory support at CARPHA, and when necessary, sending samples on to further reference laboratories, for example, CDC. So CARPHA would like to, similarly to PAHO, congratulate the Ministry of Health and the population of St. Lucia for the work done in ensuring good vaccination coverage thus far, for the work done in identifying the initial cases, and in the outbreak investigation that is taking place to verify that we have identified the scope of the problem and launched the appropriate responses. And we continue to remain available to the St. Lucian Ministry of Health to provide support for both surveillance and for laboratory diagnostics.
Local officials have received a passing grade from the PAHO representative on the management of the potential crisis.
Since we have arrived, we have visited health facilities. We have also had discussion with the Ministry of Health. And in our visit to health facilities, what we have done, we were looking back since January 1 to see, did this outbreak start very early and not when the first case was identified. And from the information that we have seen so far, we feel that the cases started when with the first case. So we think that the possibility that this outbreak could have been started in 2014, the information does not support that. And in addition, we have also looked at some of the vaccination coverage at health centers and we have looked in their books, and we see that children are appropriately vaccinated. We do not have quite a lot of defaulters existing, but we are very pleased that the Ministry of Health had put together teams that were actually going for defaulters and going into communities to identify persons who were probably partially vaccinated. So I think our work so far has been extremely rewarding, and we have evidence to back up whatever information we'll put out later.